Good afternoon, dear patients. Today we will discuss a case presented in the picture. This is a case of peeling of the penis, peeling of the penile skin. A patient came to us complaining of a heavy coating in the area of the glands, penis and foreskin, generally massive deposits, pain in the area of the eruptions and so on. Before this, he had gone to a dermatologic dispensary where he was diagnosed with candidiasis of the glands penis just by visual inspection. No tests were taken. The diagnosis was made externally by examination as it was stated. At that time, the only symptom was redness of the glands and nothing else. Clotrimazole ointments were prescribed as well as oral fluconazole. The patient underwent this therapy for about 10 days, after which he returned to the doctor. He actually noticed a worsening of his condition. Ketoconazole was prescribed orally and pimafukort was prescribed for external use. As a result, things got even worse. The patient did not return to this doctor. The glands started peeling, pain increased, and so on. So what was done for this patient? Finally, a test for candida was performed, albeit late, but it was done. Naturally, no candida was found. Bacterial cultures were taken, as well as tests for sexually transmitted infections. All of these results came back normal. In addition, the patient was naturally tested for syphilis and HIV. Those were negative as well, and was also tested for allergies. You can watch a separate video on our channel to learn more about allergy testing. The allergy test revealed that immunoglobulin E levels were 5 times higher than normal, and eosinophils were 2.5 times above the limit, which indicates an acute allergic reaction. Apparently, this was initially an allergic balanoposthitis, not caused by candida, but rather by an allergy, and it should have been treated as a classic allergy and examined by an allergist. Indeed, quite often, redness of the penis, some kind of coating, and other symptoms that mimic candida may even look similar externally, generally lead both the doctor and the patient to believe that it must be candida. This assumption must always be confirmed by tests, which in fact has not been properly done for any of the patients who come to our medical center. Accordingly, if such tests had been conducted, it would be clear that candida accounts for, at most, about 20% of cases with these symptoms. Therefore, everything else is not candida, which was also the case with this particular patient. Everything else that was done essentially caused harm to the patient, as the allergy was aggravated even further by the medications. As a result, naturally, the penis began to peel. Therefore, overall, it can be said that the doctor caused harm by not recommending the necessary tests and by continuing the treatment despite the lack of effect. Naturally, the patient was reassured, and he was given classic anti-allergic therapy at that point. All medications were discontinued. He was prescribed simple cool compresses, sodium sulfate, calcium gluconate, and initially prednisolone. Accordingly, this allergic reaction was resolved within about 7 days, after which the skin of the penis was almost completely cleared, with only slight redness remaining. Later on, the patient was examined by an allergist, and a number of allergies were identified, both to medications and to various food products. Appropriate recommendations were given, and the relevant therapy was carried out, which is not directly related to either dermatovenereology or urology, but dermatologists tend to think they are the main specialists when it comes to any redness. However, after diagnosis, it turned out that this patient was more of an allergology case rather than a dermatological or urological one. That is why in our clinic we have a dermatologist and allergist with 2 specialized degrees. That is why we specialize in various types of skin redness and rashes in the genital area, which are often of allergic origin.